and she incorporates mind-body medicine to help people with anxiety and stress. She's also a former ER physician, so she has a really good understanding of what's actually happening in our bodies physically when we experience anxiety and stress. So today we're going to talk about how do we cope with those physical symptoms of anxiety. So welcome, Suzanne.
Hi, everyone. Thank you, Rachel.
All right, so let's get started. Our first question is, what are the physical symptoms of anxiety? How do we recognize when we are experiencing anxiety?
Before I get into that, anxiety is like extensive worry that we have during different situations in life, and that it can manifest itself in various ways. One of the ways that we experience anxiety is through our body, which has physical symptoms that we sometimes are not aware. We go through them. We think it's like sicknesses and diseases, whereas it's the manifestation of anxiety in the body. The most prominent ones is when you feel like your heart is jumping out of your chest. It's the pounding of heart. Sometimes people describe it as, I can literally count my heartbeats without even touching my chest or putting my hand on my chest. If I have rapid heartbeat and I can feel it, and it's very troublesome. Sometimes patients complain about, it seems like there's an elephant sitting on my chest. Tightness in your chest, you can't breathe, your breathing is shallow and fast, or it's as if you cannot breathe at all because you feel something is stuck in your chest and you're about to faint.
Yeah. And those are very scary symptoms, the ones that you've just described, for sure, at least the pounding in the heart that can sometimes make people worry, perhaps, that there's something wrong with their heart, right? Yes. Or not being able to breathe, that can be really scary too.
A lot of people describe it as if they're having a heart attack. That's why a lot of them really rush to the emergency rooms thinking there's something wrong with their heart, whereas it's only anxiety. So other ways people experience anxiety might be in their digestive system. Sometimes they complain about upset stomach. They explain as there's a pain in my belly, I have pain all around. Sometimes they have nausea, in extreme cases they start vomiting. Sometimes it shows itself even as diarrhea. So all the physical symptoms of actually anxiety that you're experiencing in your digestive system.
Right.
And then some people complain of headaches, like terrible headaches. Sometimes it shows up as muscle tension. It's like twitches, like shaking, and even people experience trembling. They say there's as if there is something inside me buzzing.
Oh, like the whole body is moving somehow.
Yes, from inside. Or even it can be a very obvious shaking of different parts of their body. Another way people experience anxiety in their body is that they have frequent trips to the restroom, or when they go to the restroom, they have difficulty emptying. So they require to go back and forth so many times without actually being able to empty their bladders.
Yeah, so it sounds like it impacts a lot of our different physical bodily functions, gastrointestinal, heart, head, maybe migraines, head, and the headaches. There's a lot of different parts of the body that could be impacted.
And one very prominent one is sweating. People are sweating all around their body. Sometimes they have sweaty palms, sweaty hands. So as you can see, it's anxiety manifesting itself through various symptoms. As you mentioned, different parts of the body, different organs get affected, but it doesn't show it. So a lot of times people don't know this is anxiety actually. There's something physically wrong with me. there's some disease, or they get really worried about it. And a lot of times, all these symptoms, or some of them, bring people or patients to ERs.
Mm-hmm.
We think they should be looked at and taken care of, and they're very scared.
Yeah, it sounds like it's a lot of different types of symptoms that would be very scary.
Mm-hmm.
Yeah. So maybe you can talk a little bit about why that is, why our bodies react in that way, and in different ways. Of course, it sounds like for everybody, I'm sure not all the symptoms might apply, but what happens? Why does that happen that way?
Yeah, sure. So what happens is that when we are starting to feel anxious,
Mm-hmm.
there's a system that gets triggered in our body, and mostly, first of all, in our brain.
Mm-hmm.
At that moment, there's a perception that we are getting information from our environment, or like our senses become triggered based on some stimulus, or there is a thought happening in our mind. There's a thought process, both of which gives us the perception that there's a threat in the environment, that we are become fearful and become scared. So
Yeah.
based on that, our nervous system starts reacting, because if you think there's some danger in your environment, your body starts getting ready to respond, to either take care of yourself with the fight response, or flee the situation in order to save yourself. So there's a part in our brain that gets triggered, which says, okay, there's something wrong around you. You better get rid of it, or you better flee and save yourself. And that's where the signal transpires into the rest of our body as, okay, my heart needs to get ready. I have to start breathing the way I'm breathing. My muscles need to become tense so I can actually either fight or flee.
Okay. So, and that's the other thing that you were mentioning earlier, I was thinking about is the tense muscles. It might not necessarily be as strong of the symptoms, let's say as migraine or, stomach upset, but simply kind of getting those knots or that tension in your shoulders could also be a symptom.
Mm-hmm.
So, so you talked about like the fight or flight, but how does that relate to with the heart? That makes sense, right? Your heart's trying to pump more blood to help you run away or to fight. But what about the other symptoms with the stomach or the migraines and things like that? Why does that get disrupted when you have anxiety?
So it ties back to how you are, first of all, defining what's happening in your environment, which is you perceive it as a threat. And then in order to get ready to respond to the situation, your autonomic nervous system gets activated. And part of that is your sympathetic nervous system, which that innervates all organs around your body. It doesn't only affect your heart or your lung, but it innervates your digestive system, it innervates your hormone producing system, and your muscles and all that. So when it gets triggered, when it activates, it does not discriminate. It doesn't say, okay, let me only go to the heart and to the lung,
Mm-hmm.
that the body is ready only there. So as it activates, it kind of produces a lot of neurotransmitters all throughout your body, and that's the responses or the symptoms that we see is the result of activation of your sympathetic nervous system.
Oh, that makes sense. So it's all of these processes are part of that nervous system. And so when they get triggered by that threat, let's say it's the thought that I'm not safe for whatever reason, or that there's a danger, whether that is real, let's say immediate or not, just having that thought is scary enough to activate the system. And once that nervous system gets activated, it impacts all of these different body functions that we have.
Yeah, that's how it actually functions.
Okay. So it's important, certainly, for us to recognize that, because a lot of times we experience stress or anxiety, and feel the muscle tension or the tightness in your belly or your chest or things like that. Maybe not always so extreme as the heart beating out of the chest, but all of those are all symptoms of anxiety. So what can we do about that? So once our body has been triggered, whether it's the thoughts or what have you, what can we do about it? How do we stop that system from being activated or slow it down or bring us back to calm again?
Sure, of course. So the first step is you become aware, just knowing what's happening throughout your body, becoming knowledgeable about it. Just that's the first step, because information is empowerment. As long as you know, okay, my heart is beating so fast, but that does not mean I'm going to get a heart attack.
Right.
I can't breathe, but that does not mean that I'm going to suffocate now. So the knowing part is the first part that gives you the more control in what's happening throughout your body. And the second thing is, so as we talked about how the perception of the threat by itself activates and triggers your sympathetic nervous system, there is another part of the brain or the nervous system that's called parasympathetic. Then that is the part of your nervous system that brings stillness, calmness, tranquility to your body, which is charge of slowing down your heartbeat, making your breathing easier. I mean, relaxing the muscles, relaxing your digestive system. It's the part of your nervous system that brings, when you're heightened, it brings you back down from that heightened state.
Okay, so that's what we want to activate is we want to try to turn that nervous system back on to calm the whole body back down, right?
Exactly. So now that we know how we got triggered, we do have techniques to kind of call the parasympathetic to get reactivated again to take care of what was happening throughout our body.
Okay.
So like an antagonist to the sympathetic system is the parasympathetic that will bring that sense of everything's going to be okay to your perception.
So how do we do that? How do we activate that system and let our bodies know that we're safe and everything's going to be okay so it can slow back down and bring that sense of calm back?
Yeah, that's a very good question. So remember how we started responding to anxiety by heightened breathing, shallow, fast, heartbeat goes up, everything stumbles out of control. We can activate parasympathetic by different techniques and tools. There are a lot of techniques from breathing to imagery to using images to using thinking about calm and peaceful situations that we've been in before, to incorporating movement, dancing, different activities. But one of the easiest ones is actually using breathing technique. Because your breathing will activate a nerve, which is called vagus nerve, which is kind of sitting at the top of your stomach or between your chest and your belly. And when we are starting to do deep breathings, we activate that vagus nerve, and that nerve it gets connected to the part of your brain. It actually travels up back to the brain and activates the part of the brain that says, okay, there's nothing going on. I don't have to be scared. Everything's going to be fine. So when you activate that part of the brain, which activates parasympathetic nervous system, then all the information that is sent to the body is telling our body to calm down. So simple breathing techniques can activate your vagus nerve and can kind of help you when you're going through your anxiety symptoms.
So can you demonstrate that? Just I think one of the things that comes up sometimes is, like you said, the breathing is shallow. So how do we know that we're breathing deeply, and what's the process for that?
Okay. I can kind of demonstrate how when you're going through that feeling of my God, I'm going to lose it. I can you can easily kind of find a quiet place, somewhere that you won't be distracted, and find yourself and sit somewhere quietly, and then start breathing. And by breathing, you start doing the technique that is called soft belly breathing.
Soft belly breathing.
Mm-hmm. And how about we demonstrate it right now? And
Yeah, let's do that.
okay.
Yeah.
So as you find yourself in the space that you're sitting, you kind of notice what's happening throughout your body, which is like going all crazy, right? So you start focusing on only your breath, which means you start focusing on when you inhale and when you exhale. And as you start inhaling, you focus your attention to the air that you're taking in.
Okay.
You follow your breath inside your body. As you're inhaling, it goes through your nostrils to the back of your throat, goes down to your chest, and then it goes down to your lungs. And you're kind of imagining that you're following it and it's expanding your lungs.
Okay.
So when the breath turns into the exhaling part, you literally follow it back, like you're feeling your lungs are pushing the air out, and it goes up your chest, back your throat, and out your nostrils. So this is how you start by paying attention to the breathing part. As you're doing your inhales, you tell yourself in your mind or in your head, or you can even do it loud, soft. And as you're exhaling, you say belly.
Oh, so you breathe in and say soft, and sort of as you're breathing in, you're following the air all the way down to your belly. And then as you breathe out, you're saying belly and following with your mind the breath all the way back out.
Exactly.
Right.
So this way, not only you are using your vision, your imagery, you can kind of imagine the breath as it's flowing throughout your body, and you can imagine as it's flowing out. And then when you're calling your imagination to follow this sensation, because you're saying soft, saying belly. So both of these techniques, not only you're using your breathing technique, you're using that imagery as well. And then as you are kind of following with that pattern, you'll notice your body is going to shift. After some time, when you're doing that, you might feel a little bit of the tension in your muscles going away. You might feel a little bit lighter. Different people go through different experiences, so it's very unique.
Okay.
And as you're doing that, the other part that you add to your exercise is you want to think about either someone that you really feel close to, or your loved one, that thinking about them makes you feel warm, connected, and safe. For some people, it might be imagining a place they have been before, they have visited, that given them that sense of joy. For some people, it might even be an image or an object, whichever you connect with more. This is what you incorporate in your breathing. Like as you're breathing in, you're calling that person, that space, that like a safe space, or that image into your mind, into your body. You imagine the person that loves you or you connect with a lot, or that space, you call into your body. And then as you're breathing out, you stay with that feeling that image brings for you.
So you try to put yourself with that person or in that place, whatever it is that you're imagining, you try to imagine as if you were right there.
That's exactly the way you experience it.
Or another image might be a color, like a color that you love, for example. Like you could focus on just the vibrancy or a comforting color like blue. I think blue is a calming color for a lot of people.
Yeah, as I mentioned, it's a different, unique experience for each person. So whatever works for you, and
Yeah.
then even use this with kids.
Mm-hmm.
Because for kids, just focusing on the breathing part and saying soft belly is probably not going to be that helpful. But when you talk to them, they sometimes, when you ask them, sometimes they say the animal, their pet, brings the most joy and happiness. So they sometimes talk about their cat, maybe their dog, maybe there's a very special stuffed animal they love. So this technique can be used with adults and children as well, of course.
Yeah, I think that would be, it's really great, a simple thing to do with kids, especially right now if they are feeling more worried about anything, whether it's their friends, their family, the germs, or what have you, just helping them to regulate their body through that breathing and then adding in that image of something that brings them happiness and joy. It's a really powerful technique. It seems very simple, but I think it's really powerful.
It's
Um,
simple, it's powerful, and it's available. You don't have to do anything for it. You just need to find yourself a very quiet space for
mhm.
5 to 10 minutes, even 5 minutes, and you'll see the effects of the more you practice this and incorporate this into your daily activity, the more you will be able to control those symptoms of anxiety.
Right. And I think the other thing, just as I was sort of breathing along with you during the exercise, the other thing I noticed is that it does bring my attention away from the thoughts. So if
Mm-hmm.
you are having scary thoughts or things like that, for example, it seems like focusing on the breath, focusing on and adding that soft belly, and then adding that image, it also helps you to move away from the thoughts that are threatening. Let's say if you're having anxious thoughts, right, or worried thoughts.
Mm-hmm.
So it's helpful for your mind and your body to
Yes.
bring yourself back to a calm place.
Yes, and then being able to control anxiety is the combination of paying attention to the integration of mind and body, because
Mm-hmm.
a healthy body
Mm-hmm.
happens when you have a calm mind, and then a calm mind it happens when you have a healthy body. So
So they work together.
they work together. Yep.
Yeah. So I think it's really fascinating to understand if you are experiencing any of those symptoms, stomach upset, like you said, the gastrointestinal, the heart, increased heart rate, let's say, the feeling of something just buzzing under the surface throughout your whole body, migraine, headaches, um, heaviness on your or pressure on your chest, maybe where you don't feel like you can breathe. Those are all really scary, but it's a very simple strategy you can practice with the belly breathing, the soft belly breathing, to slow that down and just to check out, maybe I'm okay, maybe this is anxiety. So just to be able to recognize it as this is what the body does when it feels anxious, that alone, it seems like, is the first step in sort of slowing down the process and knowing I'm okay. This is anxiety. This is how your body responds when it feels anxious.
Yeah, that's very true. The first thing is for you to know that there's actually no threat out there.
Right. Like I'm safe.
Nothing's going to happen in this moment in
Mhm.
time. And this is something that I perceive and I'm thinking about. This is part of my thought process. Um,
Mhm.
I want to make sure, I mean, reiterate the fact that I really want to make sure that people are aware if they have some um, illnesses or
Mhm.
something that is they have been going through, to take that seriously. I don't want somebody to have
Sure.
some pain or suffering or some heartbeat that it's irregular and they only think that it's only anxiety. So make sure, I really want them to talk to their physicians, make sure that there's nothing physical going on, and then but as we know ourselves, we know how our body reacts, and a lot of these symptoms that we talked about are the results of anxiety.
Right. So that's a really good point, is there certainly are other things that activate the physical symptoms in our body, making sure that we check that out and making sure that we get a clean bill of health, so to speak. I think sometimes maybe there's the frustration that happens when people do go to the doctor and they say, well, there's nothing wrong. And then that might be a sign to look at anxiety as a possibility. And certainly right now, as everybody is coping with the coronavirus, and there does bring a real threat in the sense of whatever it is, personally, there is more of a heightened anxiety overall.
That's very true. Yeah.
Mm-hmm. But this is something simple that we can do at home. We can do it, like you said, anytime, any moment. Even if you're driving in your car, you can still take a few deep breaths and just help your body to slow down.
It really helps whenever you're feeling the anxiety coming up. You can pull over. You can excuse yourself, go to another room. It's available. It works. And the more you engage in it, the more you feel the anxiety has less effect on you.
Right. That's another good point, I think, is that because the way that you described it, it sounds like, the body's response is automatic. And so it can start to feel like I have no control, right? But by adding in that technique, the breathing, the imagery, then you actually are bringing a sense of control back, that you do have control, that you can slow your body back down and feel calm again.
That's very true. Yep.
Yeah. Great. That was super helpful. Thank you so much, Suzanne, for explaining that to us. So Suzanne does offer mind-body related therapy, as well as other types of therapy for anxiety or stress, and other stressful things that you might be dealing with, right? If you want to give her a call, you can call 832-559-2622 to schedule a free consultation, or you can find her online at edenscounseling.com. Thanks so much for joining us today, Suzanne.
Thank you. It was nice.
All right. Have a great day.
You too. Bye-bye.
Bye-bye.
Bye, everyone.